Hello, I'm Mayor Todd Kasenberg of the Municipality of North Perth. Welcome to another edition of Todd Talks. Today, I'm joined by Alex Burgess from the City of Stratford. He's the manager of Ontario Works. And initially, what I'm going to do is ask him to tell us what he does. Alex, welcome.
Thank you, Todd. So I'm the manager of Ontario Works, and I also oversee homelessness programs for the City of Stratford. At the City of Stratford, we are the service manager and responsible for the delivery of programs across Stratford, Perth County, and St. Mary's related to homelessness, children's services, housing services, and Ontario Works.
Great. Well, thank you for orienting us to what you do. Now, we're going to talk in this episode about homelessness and homelessness in both Perth County and North Perth. I'm looking forward to learning a little bit more about what we should know about this subject in our community. I'm not alone in taking note of an apparent rise in homelessness in both North Perth and Perth County. So first, maybe you can give us a little bit of the homelessness landscape, sort of what's happening out there, from rough homelessness all the way through those who are precariously housed and maybe even beyond. And give us a sense of scope. How large are those circumstances? How big is this challenge?
Of course. So I think as we're all aware, across the province and the country, we've seen a rise in homelessness over the last few years, related specifically to the fact that housing prices are becoming quite unaffordable and unattainable for many people in our community, especially individuals living on a fixed income. In Perth County specifically, we do track this information on what we call our by name list. So a by name list is an opportunity to know every single individual in the community experiencing homelessness by name so that we can attach appropriate supports to them. And on that list, as of August, we had 119 individuals who are experiencing chronic homelessness in our community. Chronic homelessness refers to 6 months or more in a 12-month period that they're experiencing homelessness. So the numbers are quite concerning, and we've been doing a lot of work at the city to try to address this. And we are a Built for Zero community, which means that we're part of a national campaign to try to end chronic homelessness in our communities. North Perth specifically, it's very hard to try to nail down the numbers on any given day, but we, based on kind of what our outreach team sees in their interactions with individuals who are sleeping rough at this time, we think there's around 7 to 10 individuals who are sleeping rough in the community. Couch surfing or precariously housed, or individuals who might be underhoused, it's a very difficult number to come up with, as first off, some individuals, they don't see themselves as homeless, even if our definition says they may be. They may be staying with family or friends, and they may feel secure there, where someone in that exact situation may be staying in a space they don't feel very secure, or they know there's no stability, and that could then increase those numbers. So we know that there may be a bit of give or take in those numbers that may not speak to the exact amount, but we do our best to cover off as many places as we can and make sure that we get as much information as we can so we can attach supports to the individuals in our community who are experiencing homelessness.
Great. Thank you for the setting the stage for this. So I've noted in various reports that come across my desk this sort of sense of a philosophy around housing first.
Yes.
Can you help us understand what that means and how it guides the actions of yourself and other stakeholders?
Of course. So housing first is exactly as it sounds. It means that someone deserves housing first before they have to work on anything else. So no one has to be housing ready, as many people say. Everybody is housing ready. It's a basic human right. Finding housing is always the first step if someone's experiencing homelessness. There's no need to be sober for so many days before you enter into the program. It's let's get you housed, and then let's start working on any other things that are contributing to any negative impacts on someone's life. Housing first it's a very widely accepted philosophy. A lot of places are using it and putting it towards the work that they do because it does speak to just the basic necessity of housing. We use it in a lot of our programs. Our supported housing of Perth program is a great example. That is what you'd call a housing first intensive case management program, where there's smaller caseloads that are really matched to the acuity or the depth of need that the individual has, and they're very individualized client-centered services. And we will always start with housing. There's no need to work on other things first. We can work on different things in conjunction with the search for housing, but housing is the primary goal, and that is the primary philosophy that we work from.
Okay, thank you. That's a great orientation to that philosophy as well, and how it guides action in our communities. So I'm glad to know that. Let's dig a little deeper, just for a few moments, if you will. Tell me a little bit about the journey that all of the agencies who are involved in homelessness sort of experience, how they get involved when they become aware that someone is homeless or sleeping rough in particular, and that those individuals or an individual wants supports. What happens then?
So the first step is once an individual is identified as homeless, and it varies on agency that they would go to. Some agencies, they do have some housing-focused programs within them that they could try to attach someone to. We are working towards the implementation of what's called a coordinated access system. So coordinated access is basically that there's no wrong door into the system. You can go to any of the access points that we have in the community. You will get the same response to someone experiencing homelessness. We do a screening tool with that individual. Then we do what's called a by name list referral to make sure that we do know who that information is, so that support's going to be made available as they are. Once that by name list referral is done, if the individual does require emergency shelter, they would be referred to the city of Stratford. We don't have a bricks and mortar emergency shelter, as you are aware. We do use our hotels and motels. Unfortunately, right now, we only have hotels and motels in Stratford. That's something we continue to work on, is to have some form of emergency shelter available in North Perth. We continue to do some outreach with the motels up here to see if that's something that they're interested in collaborating on, in a service that they want to provide. So we do work with those individuals. So if they do require emergency shelter, we'll go through. We try to operate what's called a housing-focused shelter program. So from the day that they contact looking for emergency shelter to the day that they exit, we continue to work on how to find housing and resolve their experience of homelessness. And from that, we use what's called a housing action plan, which is just what does that individual want? Where do they want to live? What does that look like to them? How many bedrooms do they require? What is within their affordability? And then once we have that individual secure in a hotel on a time-limited stay, extensions are based on their level of engagement. So as long as they're willing to work towards resolving their homelessness within the scope of what they're able to do. We always set realistic goals with individuals to make sure that they're very individualized. It's not a blanket, this is how much you have to do. It's what can you do within everything else that you have going on, with the end goal of looking to resolve your homelessness and look for housing. Our outreach staff at the city will work with those individuals, or there are other agencies that may work with them. And through coordinated access, if there are other agencies who are drawing their intake from the by name list, which basically means they have programs, they may have case management spots available, and they say this is what this case management program is for, and then they would take the highest depth of need off the by name list. It's not a chronological list. It's based on the depth of need, so the individuals who require the most support can receive it. And then programs are matched based on that individual's depth of need.
Great, thank you. Let's talk about the fact that honestly, sometimes homelessness overlaps with addictions or mental health compromise. How do circumstances like that affect the work that you do and other agencies do with the homeless?
So as I mentioned, through the Housing First philosophy, there's no barriers that we put up. So mental health and addictions, they may be co-occurring with someone's experience of homelessness, but we want to make sure that we still put that housing focus first. We're not saying they have to enter a treatment program of any form. If they want to receive support for their addiction or for their mental health, we will make referral to some of our partner agencies like Choices for Change, like Family Services Perth Huron, who do excellent work with so many individuals in this community to work on their mental health and addictions. And we will make those referrals based on what that individual is asking for. It can create additional complexities for individuals. Mental health, as we have seen, has become even more prevalent than it was in the past over the course of the COVID-19 pandemic. And it continues to impact the lives of so many people, and individuals experiencing homelessness are no different. But we do know most of the people who suffer from some form of addiction, they aren't homeless. A lot of people who deal with addiction in their daily lives are housed. So we know that it is a barrier, but it's not going to prevent them from reaching that end goal of being housed. And we generally will continue to work with those individuals and identify what makes the most sense for them, what plan towards resolving their homelessness works. And then we have also invested with Huron-Perth Healthcare Alliance and with Perth County EMS for a community paramedicine and nurse practitioner program, which does connect and it's focused on individuals who are precariously housed or experiencing homelessness to make sure that they can receive primary care for issues such as addictions and mental health, in conjunction with the work that so many of our partner agencies are doing to make sure that those are brought to the forefront, that their medical needs are addressed, and then we can help move them along that continuum to housing and make sure that they receive the proper supports.
what you've described so far, it seems like it's a very large umbrella, and there are many players in this umbrella who are willing to collaborate and work together to try to tackle homelessness and all of its attendant comorbidities, if you will, or coincident circumstances. I'm impressed. I had no real concept of how many players there were until getting into this role, and I'm sure that many who will view this video really had no idea of the number of moving parts, if you will, in our system. So thank you for helping us with that. There's a dilemma in dealing with the homeless, of course. Some have focused on compassionately supporting and recognizing the dignity of all as a guiding principle for actions with the homeless. Others seem to have almost a competing position, that we need the homeless to want to break their cycle, that they need to be good, productive citizens, they need to be clean of drugs and all of those circumstances, with sort of the notion that their choices led them to their circumstances. From your professional vantage point, how do we navigate amongst those sort of competing positions?
It does make it difficult because there is a view of individuals experiencing homelessness that they either chose to live this life or it's a result of past decisions. But quite often we see that is not the case. There may be a very small percentage of individuals who do choose to sleep rough. We're talking an extremely minimal amount of the individuals who are experiencing homelessness. And when someone does not want to work to resolve their homelessness, a lot of times there's other barriers that are in place, or we need to adapt our system to make sure it meets those individuals' needs. There are times when an individual does not want to engage in programs. That does happen once in a while. It's not a frequent thing that we see. And then we just have to continue being relentless in our pursuit of how we engage them in programs, and maybe modify a bit, maybe change our approach a little bit with them. Maybe ask them what they are looking for, what's the end goal look like for them, and then how do we work to support them in getting there. If someone doesn't want to work with us, they don't have to. That's not something we would ever force on an individual. If you are accessing emergency shelter, it's a requirement of being in shelter that you're looking to resolve your homelessness. And as I mentioned, level of engagement can vary based on the individual. But there is this widespread notion that people experiencing homelessness don't want to resolve their homelessness, or they choose to live this life, but that's not really true. And in fact, it's like, as I mentioned, it's such a small percentage of that group that it's quite infrequent that our staff come across individuals who do not want to work to resolve their homelessness. They may not want to work within the exact way the system is designed, but I think then that goes back on us as the homelessness system of care and as our coordinated access leadership group and all the agencies who are part of that group to make sure that we design our system to respond to the needs of all the individuals in our community. Is it going to be perfect and match for everybody? One day we hope so. At this point, we know that we're just doing our best to get there and make sure that all the individuals experiencing homelessness receive the proper support that they need to get themselves housed as quickly as they possibly can.
Very personalized, it sounds like. There's
Yes.
a lot of personalization that's going into the work and even the thinking about how to get those who want assistance and support to a place where they are appropriately housed.
Well, we know every individual is unique, and every individual has their own complexities and needs and wants and things that they want to work towards. And individuals experiencing homelessness are no different. They're people just like us. They have their wants and needs. They want to work towards something in life, and sometimes through no fault of their own, they may have ended up in this situation. And some individuals, maybe they made a bad choice in the past, but should they be punished forever because of one singular bad choice? Most of us, if we made that bad choice, we wouldn't end up in that same situation. And I think it's about just being a human and looking at that from that human lens and making sure that we respond to those needs and we offer those services as person-centered and client-centered as we possibly can.
And I think one of the things that sort of stands out to me is that sort of tension between short-term and long-term solutions, and how what you've described so far seems to suggest that there's a real focus on long-term resolution of homelessness, long-term supports. So can you just sort of comment on that?
Of course. So we know with emergency shelter that it's required, but we also want to move away from a world where emergency response is the only way we respond to homelessness. By being proactive, by putting in programs like our SHOP program, we've seen success. In SHOP, there is over 80% of the individuals on that caseload are housed right now. And those are what we would say have the greatest depth of need or the most complexities in their lives. And we've seen great results from that. And that's been because we focus on long-term permanent housing options. Short-term solutions, there's a need for them. That's why we operate the emergency shelter program that we do. But the whole time, our intention is to turn our focus towards long-term housing options. And we know that the only way to resolve homelessness is housing. We can put as many short-term programs as we want, and we want to make sure that there are agencies and programs that respond to their needs while they're experiencing homelessness. But even those programs at the end of the day should be focused on how do we resolve this individual's experience of homelessness in the shortest period of time possible.
Great, thank you. I mean, we've already talked about some of those specific supports. You've talked about SHOP, you've talked about the possibilities of those who are at least tentatively housed on an interim basis, receiving supports with regards to addiction or mental health challenges. Are there other supports or things happening in Perth County or in North Perth that we really should know about, that we should be talking about?
Yeah, so it's, and I don't have the exact date that they're launching, but Hope Links, which is being operated by the Salvation Army up here in Listowel, they will be launching soon, which will be a great resource and a connection point for individuals who are experiencing homelessness. Salvation Army is actually our access point here in North Perth for our by name list referrals and to get into the coordinated access system of care. And we also know that the Salvation Army, we have a partnership with Salvation Army in Stratford, and they have 1 day a week in North Perth where they operate the Housing Resource Center in partnership with Salvation Army here in Listowel, which does help individuals try to search for different housing options. The rest of our programs span across the county. Those are two very specific, great North Perth initiatives that will hopefully move towards resolving individuals' experience of homelessness sooner. But we continue, as our outreach team continues to have a presence here and work very closely in conjunction with the other agencies that operate out of North Perth, such as Salvation Army, Choices for Change, Family Services, Optimism Place. There's so many great agencies at the table who have a presence up here in North Perth and do so much great work here. And I think they deserve a lot of credit, and I just think as long as we can continue moving our clients along this continuum towards resolving their homelessness, there's so many agencies that are able to help and adapt their programs to make sure that it works for them. But the Hope Links project is going to be a very exciting project that's upcoming.
I totally agree with you. I'm very excited about what Hope Links can bring to North Perth this fall and winter. And I know that they're looking for some volunteers. So
yes.
If you're out there watching this and you haven't considered volunteering and the issues around homelessness have a particular resonance with you, certainly reach out to the Salvation Army locally. They would appreciate your support. Let's talk about ineligibility. I'll get my word out yet. Let's talk about ineligibility. Given our local context, are there some people who just aren't eligible for supports?
Unfortunately, there are times where individuals become ineligible for supports. So there's times where in emergency shelter, where due to a service restriction of some form, which most likely results from damages or violent behavior towards either the motel operator, to staff going out to those agencies, or to other individuals who are staying there, we unfortunately have to place a service restriction on them. But the biggest one we often see come up, and I see a lot of people, and I know a lot of people have concerns about it, is related to individuals who are not from Perth County. Unfortunately, we in our homelessness program are funded to deliver services to residents of Perth County, and we have to try to find a way to prioritize those individuals above individuals who come from out of county. So we have to make sure that we have services that are available to Perth County residents before we look at offering services to someone from out of county. So quite often, and many surrounding municipalities have taken this stance as well, due to this strain, especially that the pandemic has put on the homelessness system of care, but in general, the strain that we see on homelessness dollars that are received from provincial government, we have to be very careful about the programs we operate and make sure that they are available for individuals in our community. So if someone is from out of county, unfortunately, we can support them with transportation back to their home community, making sure there's a safe place that can receive them when they return back. If they do choose to move to this community with support from their home community at some point, then that is completely their choice. But unfortunately, the emergency shelter system was not designed to take individuals from out of county continually. It's designed to support those who become homeless that are from Perth County and have ties to the community, social and familial ties. Great,
thank you. So another plug, just quickly, Hope Links this fall, volunteer opportunities. What else can people do? Like, the average resident of North Perth, interested in homelessness, wants to make a difference. What other opportunities are there?
Aside from volunteering with local agencies who work towards resolving homelessness, the biggest one is those who are landlords or may have rental units to consider renting out to individuals or programs that operate in our community, such as our SHOP program. The only way to resolve homelessness is housing. We need housing. That's going to be the only way that we can solve this problem. And that's something that we at the city, and I know lots of municipalities are working towards, is how do we have more affordable housing options in our community. But at the end of the day, we know there's a large contingency of private market landlords out there, and we can offer lots of different resources to support landlords to work towards housing individuals who are experiencing homelessness. So if you are a landlord, if you have rental units, please contact the City of Stratford Social Services Department, and we can partner you with one of our programs to support individuals experiencing homelessness to move into permanent long-term housing.
Alex, this has been fascinating. Thank you so much for your time this morning.
Thank you for having me.
I'm delighted to issue a special Todd Talks on the subject of homelessness. As I said, it's an issue that is, certainly arisen and seemingly increasing, and so we're glad to know what's available and how the system, if you will, supports action and remembers compassion and brings resolution to individuals who are looking for housing and who are appropriate candidates for same. So appreciate your time this morning, coming up to Listowel, and I really want to wish you good success in your continuing work.
Thank you very much for having me.
Thanks.